and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I'm joined by another nurse, Erin Dickman. Thank you so much for joining me today.
Yeah, thank you so much for having me. What a great conversation to have during Cancer Survivorship Month.
Right. And so Erin is a doctorally prepared nurse, and she works in the cancer space. So, Erin, can you tell us more about your background and how you came to be so invested in the breast cancer survivorship?
Yeah, absolutely. So I have been in cancer care for 15 years, and so I fell in love with it during my clinical rotations. I was very lucky to find it early on, and I was on the blood and marrow transplant floor. And these patients stay for over 4 weeks, and you really build this strong connection with them. And you become part of their family. And I just loved that, being able to make them feel better, them and their families, and then work with the smartest nurses I've ever worked with, solving their problems, right? Or anticipating their needs and giving them what they need. And so as I went on that path and went into direct care nursing, I was looking at my nurses around me and I got really into nurse well-being. I was on our relationship-based care committee and just trying to find ways to support my colleagues. And so I went into nursing leadership, kind of finding that bigger influence and support of nurses that support the people that support the people, right? And during that, I started solving bigger problems, and I am a lifelong learner and problem solver. And so started doing that, loving it, got involved with our local oncology nursing society chapter, and started working for them actually before I started working for ImpediMed last October. And so there, I started learning more about this bigger view of the nursing profession and supporting advancements in cancer care and evidence-based practice. I went back to get my Doctor of Nursing Practice degree. Implementation science, evidence-based practice, quality improvement became like my new passions and values. I learned about the amazing technology that ImpediMed has to support cancer survivors and decrease rates of chronic lymphedema, helping cancer patients live a better quality of life. And I became a fierce advocate. I was like, I must help this mission, and being able to help different programs around the country support their patients and measure those outcomes to ensure that patients are getting the best possible quality of life post-treatment is what I'm really passionate about.
Man, that is just amazing that you were able to work in the area that you are so passionate about, because, that's the dream, right? To wake up in the morning and be excited that you get to make a difference in the population you really care about. For our listeners who may have no idea what lymphedema is, can you give us a rundown on that?
Absolutely. So cancer patients are at risk for lymphedema. Actually, 1 in 6 battle the condition when the lymphatic system's damaged. So whether that is radiation to the area where you have lymph nodes or surgery there, pretty much if you have a knife around it, you can damage it. And then sometimes, depending on the cancer, they have to take out those lymph nodes. And so our lymphatic system's really cool. I didn't learn enough about it in nursing school, but it's extremely important. Like the circulatory system gets the spotlight, but the lymphatic system really has it going on. So, helps our immune system, clears out toxins, helps our digestive system, like move those big molecules. And so when it stops working, right, when it gets blocked, there's a bunch of inflammation. And so if you continue to have that inflammation, there's permanent damage. So lymphedema is actually, if you have that risk, is a lifelong risk. It is highest risk the first 3 years post-treatment, whatever causes that risk of lymphedema. And it's devastating. It's a constant reminder for patients that have gone through treatment, and it changes someone's quality of life.
Yeah. And I know physical therapists and massage therapists who treat patients who have lymphedema, and that has made a big difference for them. And you may have seen people wearing like
Yes,
those compression sleeves on their arms, because a lot of people will have lymph nodes from their arms removed when they're having a mastectomy, right?
Absolutely. Yep. Usually those patients are being actively treated for lymphedema. I mean, most of the time, if someone does get diagnosed with lymphedema, they're spending at least an hour a day managing it or thinking about it, with different pumps and different physical therapy appointments and trying to keep the swelling down so additional damage isn't created. And so that's why it's so important to catch it early because it's reversible, which I never knew before. And so if you catch it in those early phases when it's just fluid, it's not fibrosis like that. Thicker tissue that can't get through those blockages, then you can actually reverse those effects of lymphedema, and you don't have to worry about it or manage it for the rest of your life.
Yeah, and the project you're working on now is screenings, is that correct?
Yes. So the surveillance model of
Okay.
care. Yes. So we know through the evidence that if you surveil a patient at certain intervals post treatment, that you're able to catch it early and reverse it because it's usually slowly progressing. There are certain instances that it can be triggered and then the onset can be fast. So kind of injury to the arm and other kinds of things. But usually you can check that really small change in fluid shift to the extracellular space and be able to reverse it.
That is so cool. So
Yeah,
what are you doing to surveil it? Like what does that involve?
absolutely. So I just did a thematic analysis of all of the lymphedema clinical practice guidelines that are out there. The interprofessional team does care, Rosa, about lymphedema and preventing it, and they all have their own idea of what the evidence says. And so we have our breast surgeons, we have our physical therapists, we have the Oncology Nursing Society, we have our supportive care providers, MASC, and then we have NCCN. And so when I looked at all of these different clinical practice guidelines, they all had these themes. And so one being, we need to have an objective measurement to understand the volume of the arm, or in our case, so my company supports or has a device that uses bioimpedance spectroscopy. So instead of just in the past, historically, we've only been able to do circumference measurements.
Yeah.
So bioimpedance spectroscopy can look inside to see where the fluid is. So it can detect as little as 2.4 tablespoons of fluid shift. The patient's not going to have any signs or symptoms. Isn't that the coolest thing? So they're not going
So
to say they have
is it like
pain. They're not going to have swelling.
is it like ultrasound?
So it is low electrical currents. So there's
Okay.
256 low electrical currents. It's a machine that you usually stand on. You can also use it seated, but it has 8 electrodes. You put your hands and feet on it. You can't
Okay.
feel a thing. The 256 low electrical currents go throughout the body, and it measures at low frequency that extracellular fluid because it just goes around the cells. But at that high frequency, it goes through the cells. And so we have an algorithm that allows you to know the difference between
Mhm.
that. And then it's charted on an LDEX scale. And then you can see it's a great precision medicine tool because you can test them baseline, right? Pre-treatment, no damage to the
Yeah.
lymphatic system, and then compare it to themselves. And
Yes.
so that's what we all want, right? We don't want to be compared to the general population.
Right.
We want to know what the difference is based on our normal. And
Exactly.
so they want you to have, so back to surveillance, the evidence, what does it say? What do we need in these kind of programs? So an objective measurement, so you have our technology, there's tape measure, there's water displacement, there's pyrometry, which is another technology that does, I think, like an infrared kind of scan. But these are all
Water
volume.
displacement.
What is it?
Water displacement, like when you get in a big tub of
Doesn't that
water.
sound messy?
Stop it. Maybe
I mean, a lot of
electricity.
them are kind of hard. Like, right, when you think about feasibility of
Yes.
implementing a practice at the bed, with patients at the chair side or bedside, you also want to think about what's accessible and easy. So, objective measurement, assessment always. We have patient reported outcomes. We ask the patient, what are you experiencing? Do you have tightness in your clothes? Are things feeling different in your arms, range of motion? You have a physical assessment, right? Do I see skin changes? Am I seeing a bigger arm? Or is that there? Does it look different if you compare the arms? And then we have patient education, right? Risk reduction, which plays a huge piece in a great surveillance program. And then you need to have an intervention pathway, right? So once that patient comes to your threshold of, I know you have subclinical lymphedema or you're showing signs for lymphedema, I need a pathway for you to go to a lymphedema specialist, a physical therapist, get into compression garment. And so those kind of factors are what makes a very successful lymphedema surveillance program.
Yeah. And at this point, like, how widespread is this? Like, is this only being piloted in a certain area? Like, I don't work in the cancer space, so is
Yeah,
it already in every cancer clinic? I don't know.
no. So surveillance models are widespread and are absolutely standard of care. Unfortunately, lymphedema is still very under-recognized and underdiagnosed, and so definitely needs to be talked about more. So I appreciate you having me on so we can talk
Oh,
about this and raise awareness. Um, but it is national. There's hundreds of bioimpedance spectroscopy devices called the SOZO machines out in large academic cancer centers and surgeons' office and physical therapy offices. And so they are very widespread. Hundreds of programs out there that are doing surveillance. And we're actually even, surveillance is getting even more of a attention because it was just added to more accreditation standards for breast cancer programs. So, continually gaining support, thinking about those survivors, thinking about how to increase their chances of having a better quality of life, getting back to their normal life, and then again, anticipating some of those late effects and putting a stop to them before they become a problem.
yeah, definitely. So I guess this brings us to the $1 billion question because I have a hunch that it's going to be related. We may have mentioned this before, but
Absolutely.
if Erin, if you were given a grant for $1 billion to meet the needs that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Absolutely. I love this question. This is phenomenal. So I would absolutely revolutionize survivorship care, right? There's a gap. There's not enough consistency in follow up, in a plan, and survivors are out there trying to live a normal life, and it's really hard for them to get back to normal, and we shouldn't expect them to, right? They feel like, oh well, my cancer is gone, I should be able to live with this side effect or this pain or this discomfort or this lack of sleep or this infertility or whatever it is. Like, I should just be grateful to be alive, and that's not a way to live. And so I would love to see a consistent, individualized, evidence based national survivorship program. And I think nurses could lead that. I
Yeah.
think that they're just the right people to guide survivors through that really rocky point, of getting back into normal life. I mean, it just can't stop when we're done with treatment. There's too much evidence now. We know too much, right?
Right.
And as nurses, like I loved the anticipating people's needs and giving them what they needed before even maybe they even knew it,
Yeah.
right? And so we are just the right people to connect that interprofessional team, to be those cheerleaders and advocates to those patients, to notice when there's maybe emotional or psychosocial or mental questions that we need to assess and look for, and then provide them really the support they need to thrive, not just survive. We're thriving. I want you to live that full life. I don't want you to think about, can I make it to my daughter's wedding because I have incontinence or I need to, I have this issue or pain or that hasn't been resolved. I want them to be comfortable living.
Definitely. And do you feel like it's pretty well established, like in the guidelines, as far as things that would contribute to the quality of life, and the struggle is more gaps in implementation and having the infrastructure to implement that, like, widespread enough to be accessible to everyone? Or are you thinking there's still a lot to do as far as determining what those steps are?
I think that the evidence is growing, and NCCN actually has a great survivorship clinical practice guidelines that really do try to put that detail and insight into it. But it's hard. It's hard because every individual is different. And having that capacity and those resources and those people to be able to build those plans, right? Survivorship care plans are really important. We've tried to incorporate them in practice for over a decade, a long time, to help with that transition. And it's because they have to be dynamic. They have to continue to change and update with the person. And so there has to be someone on the other side that's willing to help change, update that for them and have a clear plan that they can follow and feel confident. Take away that fear, right? I'm going to see you in 6 months. Look at all these things that we checked you're doing, like reassurance and a plan, right? That's what we all want.
Right.
Right. At least
Yeah.
my type A personality wants a plan. But again, you look at your patient, you ask them what they want, and you shift, you adapt. And that's what nurses are great at too.
It's so true. And when we can focus on tangible steps and feel like that sense of control, then you
Mhm.
feel less at the whims of your chaotic cancer journey, right? Um,
Absolutely.
Even though we can't say that if you do this, then you'll stay in remission forever and you're going to have a perfectly smooth life if you have a like a game plan
Yes.
with steps you can tangibly take
Hmm.
that you can focus on instead of focusing on the unknown. I'm sure that just having that plan can be really reassuring, in addition to, of course, having a lovely nurse to talk to you
Well,
and
and to
provide.
educate you, right?
Mhm.
Think about people that sidestep those conversations.
Oh,
I
yeah.
went to a local community event and talked to many breast cancer patients, raising awareness about lymphedema. And
Mhm.
you wouldn't imagine how many people that said, like, oh, yeah, like I have some tightness, or, yeah, I went to PT, or physical therapy, but I ended up stopping because I didn't see the point. Like this just lack of awareness and knowledge around, things like lymphedema and
Right.
how much just that education and continued education, right?
Mhm.
Because during treatment, we know that they have a lot to think about. But that post treatment, we should re educate, re-inform. So, because I always think about that patient going home, right? Survivorship is so beautiful because you get to support them in their home, right? You give them the tools to succeed, and not just, discharge by, right? Like, I want to think about how you're going to go into your home, get the right nutrition, be able to understand if there's a symptom that you should call me about. And so, again, those continual follow ups, those conversations, that education, building that trusting relationship with your patient so they feel comfortable calling you. Those are all such important pieces of that surveillance and preventative model of care. And
Mhm.
that's why I really appreciate this technology. It moved lymphedema from a reactive model to a
Mhm.
preventative model.
Right.
Um,
And does this fall under some of the like chronic care management things that are being developed that are expected that you can bill for?
yeah, so from cancer therapy, there's two different kinds of side effects. So those long-term side effects, which are absolutely managed during survivorship too, and so that are going to be chronic. So those happen actually, the long-term effects happen during cancer treatment, but
Mm.
they linger on after treatment. And then there's these late effects. And so things that can happen, dysfunction. So lymphedema being one, cardiotoxicity, osteoporosis, those are late effects, right? They might not show up until 2 years, 3 years, 4 or 5 years after treatment. And so all of those are really important factors to be able to assess for and look for or manage during that survivorship journey. And unfortunately, so I know you talked about like billing and everything. I'm not super familiar with
I
all
hear
of the, I know that our technology, there is a code where you can bill for it.
you.
So, but that's my realm right now.
Right. Well, in the hypertension management and things like that, chronic care management, there's so many different companies that are popping up now that are doing that, like I don't know if it's weekly phone calls where they talk to the person, make sure they're taking their blood pressure at home, stay on the phone with them, talk to them about what their daily values are, for example,
Mhm.
provide that
That's
reinforcement of education, talk to them about their medicines and things like that. And because they're preventing those
mm.
hospitalizations from things like hypertensive crisis or the weight fluctuations in heart failure. I think a heart failure is a really big area that gets this service. And so I didn't know if it was, if there were companies like that doing the follow up like you're describing.
Oh, survivorship. So,
Mhm.
um, I believe there are some that are popping up, and sometimes, if they're nurse led, it's more of like a nurse navigation type of support. But I also know that sometimes there are organizations or hospital systems that will contract out with those kind of systems. But a lot of times there's also a need to come in person. And so you can't contract out some of those pieces of it. But I do love that gap strategy,
Yeah.
right? Someone to check in, someone to ask those important questions. Whether that's a text message or maybe you fill out a couple of, those patient reported outcome measurements where you check on their symptoms. Yeah, I think that could be the future. I think you're onto
Oh,
something
yes.
if they don't have it already.
Right. And so, that's why I love having these conversations because, as much as you and I care about this, nobody can know everything. So, if anyone listening to this knows of places that are putting this into practice, reach out to Erin, reach out to me and let us know because we want to be able to connect those dots so that people can get what they need. So, um, was there anything else about the aftercare that you would like to share?
I feel like we captured everything. Just I guess reiterating, there's not a one size fits all when it comes to survivorship and follow up, and really, urging the time to be personalized, and then really look at that whole person care. I think is just really good foundational building blocks for survivorship. Survivorship.
And not just that person in that one time, that one snapshot in
The
time, but
dynamic, ever changing person. Yeah, that one.
yeah, and I hear you about the education needs and that reinforcement need because I talk to a lot of stroke patients, and you and I both probably are very familiar with the idea of you retain about 10% of what you learn the first time, and you need that reinforcement to add another 10% and another 10%. So, I mean, if the math is mathing, that means like 10 different conversations,
Yeah,
right?
I think you're so right.
So that,
Absolutely.
that's a lot of reinforcement that's needed. So I don't know, Erin, maybe you'll need to make a podcast to do this education so people can press, what did Erin say again? I'm going to
Let
replay
me
that,
just tell you. Yes. Let me
right?
show you the evidence. Let me give you, yeah, absolutely. I love that.
Exactly. There's room for more podcasters, you guys.
You're doing
Should you
so great, Rosa.
like you should always listen to every episode of Nurse Rosa's Insights. But if you're like Erin and you have this other whole area of expertise, just remember like this is a great way to put your expertise out there and share it with your target audience in a way that they can, you know, if they don't retain it, they can replay it and listen again later. So,
Look at you planting that seed.
yeah,
Let me
girl.
just water that. And I'm going to, I love that. Um, Thank you. Yeah.
Definitely. You're doing great things, Erin. So if anybody wants to reach out to you, should they find you on LinkedIn?
Yep. You can absolutely find me on LinkedIn and I'd love to connect.
Awesome. And I'm on there too. You can also follow me on the other social media platforms at Nurse Rosa Speaks. So if you've enjoyed this episode, please like and subscribe wherever you're listening or if you're watching on YouTube. And make sure you tune in for the next episode. And I'll see you then.